Hi, welcome back to Veterinary Referral Center of Central Oregon's Facebook Live discussion on dogs and cats who lick and scratch and bite. Sorry for the earlier glitch and everything. We were just getting out the kinks as this is our second show, so bear with us. Hopefully we have good sound quality now and we can have a great discussion. I'm just going to kind of recap and start things over for all of us. Just bear with me as we kind of go through the basic questions here right now. So again, I'm Jennifer Bentley. I'm one of the doctors here at Veterinary Referral Center. I'm a board certified dermatologist, so this topic is kind of my specialty. All I do is basically practice dermatology, which is just itchy dogs and cats all the time. So the big question is, why does your dog or cat itch, scratch, bite, or chew? Or rub or even shake too could be some of these symptoms. Let me know what your answer is. I will say there's a very simple answer to this question and a much more complex answer to this question. And I kind of already alluded to it as well. So chime in, let me know what you think. So the answer to this question is simple again. It's one word, and it is itching. So scratching, licking, chewing, rubbing, shaking, these are all signs that your dog or cat is itching. So in humans, we normally think about itching as just scratching, but in dogs and cats, we know they manifest it in different ways. And we're fortunate that humans aren't going around licking themselves every time they have an itch on their arm. So cats are a little bit harder than dogs to recognize these symptoms because cats are really fastidious groomers, right? So they are licking themselves all of the time. But what we do know with cats is when they're excessively doing these things, we usually see other symptoms. So it's just hair loss or something called barbering of the fur. And that's where they get a very kind of hardened fur pattern. It's very brittle when you brush them. So of course the more complicated answer to this question that we proposed is, well, why is my dog or cat itching? And it is a complicated question, and in fact, if you think about all of the differentials out there for itching, there's hundreds of them. So that's where it really takes a good veterinarian or veterinarian dermatologist to look at the history, look at the clinical signs, and really dive into this, because it's a diagnostic challenge when you have hundreds of things that can manifest in the same symptom of itching. So let me know if you have any questions. We'll be happy to discuss anything about your dogs and cats or things that you have noticed. One of the most common questions that I get is, can my dog or cat itch because of anxiety? And they can, but it's super, super uncommon. So one study that was done that really brings home this point is a study that was done in cats with psychogenic alopecia, and that just simply means hair loss due to psychogenic factors like anxiety. And they took about 80 cats with this presumptive diagnosis, and they found out that 95% of those cats actually had allergies. And so that really drove home the point for me that anxiety is not a big cause of these clinical signs. So Denali has asked a question, are puppies more likely to itch versus adult dogs? And this is a really good question because this is actually kind of what we think about on the human side of things. So humans can get something called atopic dermatitis, and it's actually even called the atopic march. And so what we know in humans is that kids will actually itch a lot more, and then sometimes that will actually fade into adulthood. So that's where maybe that question is coming from. But unfortunately, what we find with dogs and cats with allergies is that they actually will itch less as they're younger, and it tends to be a progressive disease. So they don't grow out of it like humans, it just gets worse and worse. Now take that into the factor that it may not be allergies. Of course, if it's a different diagnosis, things can manifest differently than that. That's a great question. So I just want to say too, with allergies, we think about that as a big differential for itchy dogs. In fact, about probably 80 to 90% of my clients will be diagnosed with allergies for the presentation of itchiness. But there are a lot of other diseases, like I said before, that can cause this. And just to let you guys know, kind of the big categories of these are infectious diseases like mites. There's actually even internal diseases that can lead to infections of the skin that lead to itchiness too. Things like hypothyroidism can do that. There's also some unusual diseases classified as autoimmune that can actually, the own body turns against itself, and that can lead to itchiness and some other signs too. Dogs and cats can also get skin cancer, and that can sometimes be a very itchy disease as well. So like I said before, there's a whole slew of possibilities that can cause itchiness. It's not always just allergies, but of course allergies is the #1 cause that we see in our dogs and cats today. So Ernie has asked, is it safe to give human allergy medicine to dogs and cats? And I definitely would say you want to consult with your veterinarian before you start giving human medications, because many dogs and cats, they're going to have different dosages and you can wind up into a slew of problems. So I actually do use human medications for my dogs and cats. So we use things like Benadryl and even Zyrtec. I will say that the antihistamines usually don't work in dogs and cats. When they do, it's great because it's a pretty benign drug, but they usually don't. But again, I caution you to just do it on your own because the dosing is going to be very different between your dog and cat and also you. The other medication that is very similar that's used in people and used in animals is also prednisone as well. So, and we do use a lot of that as well. But keep in mind the dosing is different, and actually cats metabolize steroids very differently, so they need a different type of steroid to even give efficacy to that. So great question, Ernie. Another question. All right, so this is something I get asked all the time is, what are the allergens out there for dogs and cats? And we kind of know them in people, but for dogs and cats it's different. So there's 4 categories of that. Flea is one, and other insects too. Mosquitoes can do it. Culicoides can cause hypersensitivity reactions. There's also contact allergy as well. Not very common here in Central Oregon, but very, very common down in the southeast due to a species called the comolino plant. So the main ones we deal with in Central Oregon are going to be food and environmental allergies, with environmental being much, much more common than food. So Shelby has asked a question, is there an alternative to allergy drugs for pets? And yes, there absolutely is. So my goal as a dermatologist is to lessen the use of these types of medications or discontinue them completely by finding the root cause. That's the whole purpose really of seeing me, and of course to get your pet under control and not itchy. So the 4 main types of allergy medications out there for itch, those include Apoquel, Cytopoint, prednisone, and also a drug called cyclosporin. Those are the 4 main ones that veterinarians will use. And so they're great. I consider them like Band-Aids, so they're really great to make the pets comfortable, but they're not getting to that root of the problem. So to get to that root of the problem, you really need a diagnostic workup for allergies, and that may be starting with food allergy and a diet trial, or it may be starting with environmental allergy testing and going on an allergy vaccine for environmental allergies. These are all great questions. So I think it would be great to talk a little bit about food allergies here. And if you're just joining us, we are talking about itching in pets, and happy to answer any of your questions that you have about itching. And food allergies are pretty common, and there's unfortunately no good diagnostic test for food allergy. So I wish I could run a blood panel for food allergens and give you an answer. And unfortunately, there's a lot out there online of supposed tests for food allergy, whether it be a blood test or a hair test. Those are really, really inaccurate. I would never use those to make any conclusions about anything. There was actually even a person who sent in fur from a stuffed animal into one of these companies, and it came back positive. So that tells you kind of the accuracy of these tests, and unfortunately the unfortunate practices that are going on online with these. So The only way to make a diagnosis of food allergy is with a proper diet trial, and that is harder said than done. It's got to be 2 months, has to be with a prescription diet, and it has to be under the guidance of a veterinarian. With a diet trial, it can be very difficult to discern what is happening at that time, because you need to really keep all the factors the same. So, for example, if you have a dog that happens to have a bacterial infection, you put them on a diet trial, you have to resolve the bacterial infection to even see if your diet trial is working. So there's a lot that goes into doing a diet trial properly, and it's not just about switching the food. The other thing about diet trials is they're just very hard for people to do. I actually did a diet for my own cat, and here I am, an expert in the field, and it didn't go well. And the reason why it didn't go well is 6 weeks into this diet trial, I found out that my cat does jump on the counter and does get into the dishes and was actually eating food out of the sink, and of course that's going to ruin the entire diet trial. So it's a very difficult process, and I understand that for people, especially in multi-dog households. It's very hard to feed the same diet and nothing else for full 8 weeks. But that's my goal, though, is to get an answer after those 8 weeks. Is your pet food allergic? Is it not? So we can have that and move on if we need to from that. So, all right, let me know if you have any other questions. I have another one from Denali, and she is saying, if my dog is extra sensitive, are there places that we should avoid to reduce allergy symptoms? And that's a really good question, and unfortunately it's hard to know what to avoid. So, for example, I had an owner, before they saw me, they were really concerned that their dog was allergic to grass, and it was allergic to grass. We did an environmental allergy panel, and it came back very positive for grasses. But before she had seen me, she actually turned her whole backyard and put in turf, which didn't resolve the symptoms. And it turned out she actually lived next to a golf course too. So you've got to keep in mind that environmental allergens is just not contacting them, it's pollens in the air too. So that can be really, really difficult to discern, okay, how do I isolate my pet from all of these types of allergens? It's virtually impossible. You can do the tests, but most dogs are going to be basically allergic to 10 or 12 different things, and really reducing those from your environment is unfortunately very hard. If a dog or cat is just allergic to something like house dust mite, there are environmental controls that you can do for that. All right, great questions. I can definitely talk to you more about environmental allergy testing, and also about kind of how we go about addressing that and treating that. It is a process, but we get really, really good results, especially in younger animals when they present, to slow down the progression of the disease and hopefully reduce these medications. So let me know if you have any more questions, any more comments. All right, I got one from Ernie. Are there breeds more sensitive to food or environmental allergies like bulldogs? And the answer to that is absolutely. In fact, we do know that there are certain breeds that they are prone to at least environmental allergies. Food allergies isn't thought to be genetic in origin, but environmental for sure. So bulldogs are one of those. Definitely bull terriers are another. Labradors are on the list. West Highland White Terriers are on the list. In fact, it's actually hard to find a dog that's not on this list and not deemed basically predisposed to allergens. But I agree with Ernie here that bulldogs are one of my top patients, unfortunately. But they are very cute. All right, guys, we're going to be wrapping up unless there's any other questions. Happy to answer anything you guys got. I'm Jennifer Bentley. Again, I'm the dermatologist here at VRCCO. Please join us again in 2 weeks. We're going to be doing the same thing at 4 o'clock. And let me know kind of comments from this section, what you liked, what you didn't like. Also, let us know what topics you want discussed. We're happy to bring on other specialists and discuss anything you guys want. And if you like this video, please give us a thumbs up. Thank you.